Hello and welcome to the TUH University Hospital podcast series of Let's Talk About. In this series, we are going to talk about diabetes. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode is for people with diabetes, their families and carers, health and social care staff, and anybody who has an interest in the health needs of people with diabetes. We will speak with experts from the HSE's Chronic Disease Management Hub here in TUH, who specialise in diabetes support and management, and our own experts in the Diabetes Day Centre at TUH University Hospital. This Let's Talk About Diabetes series has been brought to you by TUH in partnership with the Healthy Communities Development section of South Dublin County Partnership. My name is Valerie Twomey. I am a clinical neuropsychologist and head of psychology at TUH University Hospital. I also work directly with patients in the TUH Diabetes Day Centre. In this first episode of Let's Talk About Diabetes, I am delighted to welcome Ann Fitzpatrick. Ann is the Advanced Nursed Practitioner in diabetes care in the Chronic Disease Management Hub here in TUH and also at the TUH University Hospital Diabetes Day Centre. Hello Ann, it's lovely to have you here today.
Hi Valerie, it's great to be here.
So we're here to talk about diabetes, and I know our listeners will be very interested to know, what is diabetes?
So diabetes is a metabolic condition affecting an organ called the pancreas in the body. The main types of diabetes are type 1 and type 2. There is gestational diabetes as well. That's diabetes in pregnancy. Type 1 diabetes is where the pancreas stops producing insulin, and this usually happens very abruptly, very quickly. The patient becomes unwell, acutely unwell, very quickly. Type 2, on the other hand, is a gradual progression, a gradual onset, and the pancreas stops producing insulin like it used to do, or the insulin that it is producing is not being used up by the body, and there is insulin resistance. So the body is resistant to its own insulin. Type 1 usually happens in a younger person, a baby, a child. However, we have been seeing type 1 diabetes been diagnosed in older adults as well. Type 2 diabetes, for the most part, happens in older, midlife to older people, usually overweight, perhaps patients with a little extra weight. Type 2, unfortunately, is been seen in childhood as well, childhood obesity. Type 2 diabetes is usually diagnosed later in life, and the pancreas is working, but it's on a bit of a go slow. It's not producing as much as insulin as it should. And then the insulin that it is producing, the body is resistant to it.
And what might be like signs or symptoms if I think I might have diabetes, or if I'm noticing something is wrong? What should I be looking out for?
So the problem is with type 2 diabetes, especially as we get older, the symptoms for type 2 can be very vague. So you might feel a little bit tired, a little bit low on energy. But the key telltale signs I would be informing patients to look out for would be thirst. Now, not just a mild thirst, a severe thirst. Also going to the toilet a lot, because effectively what your body is trying to do is trying to dilute you because you're too sweet. There's too much sugar in your blood. Type 1, however, this is a far more acute and sudden onset. Patients could become severely unwell and unconscious. In fact, the sugars may go so high. You're talking blood sugars in the 30s, 40s, 50s maybe, and they need to get to their local emergency department.
And what is a normal blood sugar?
So normal blood sugar for someone with diabetes, for well-controlled diabetes, we'd like their blood sugar to be before food between 5 and 7 or 4 and 8. But again, those goalposts can be moved depending on the patient. You don't want someone who's frail or elderly and potentially a falls risk to have really, really tight, severely controlled blood sugars, because that could increase the chances of them falling. So that's a very specialised area. But for the purposes of talking about being diagnosed with diabetes, it is not normal to be going around with a blood sugar in double figures, so 10, 11, 12. Your pancreas is not working properly if that's happening. And put with that thirst, going to the toilet a lot. In fact, a lot of patients present with infection because bacteria loves sugar, and sugar and warmth. A lot of patients come to us with kidney infections, little skin boils, and oftentimes it's an incidental finding then. They think they're just going to the doctor with a little sore in their groin, a boil, but in fact, little blood sugar and they're diagnosed with diabetes.
And I mentioned earlier in our introduction that you work in the Chronic Disease Management Hub, the HSE's hub here in Tallaght. So diabetes is a chronic disease and is lifelong and has to be managed. So how can an individual live well with their diabetes?
Yeah, so this is such a great question. It's a chronic disease, but I think it's really important to say to patients out there, it can be a really positive thing. So people coming to me over the years, having been diagnosed with diabetes, have turned their life around. It's the first time that they actually, some of them have got to sit down and look after themselves. They've maybe neglected their diet, their exercise. They've just been on a little hamster wheel looking after everybody else, busy with life. So it's time to focus on them and look at healthy practices and how they can incorporate them easily into their lifestyle. There are various services around the country in Ireland for diabetes. We're lucky that all our patients with diabetes, regardless of income, they get all their medications for free through the long-term illness scheme. Also, anyone in Ireland with diabetes over the age of 12 can avail of retinal screening. And this is a really important screening programme for people with diabetes, because diabetes can affect the eyes. It can affect every organ in the body. Basically, what I say to patients is wherever the blood is running through your body and it's sugary, it can affect you. So we have to screen and keep them healthy, make sure that they get regular blood checks, make sure their cholesterol level is on target, their blood pressure level is on target, their kidney function is tested with a little urine sample that they can give us at clinic appointments, their feet are checked, really, really important. So it is really a head to toe inclusive condition, but the very positive aspect and connotation is they can keep well.
So it sounds like there are a lot of supports available to somebody with diabetes in the community, and certainly from the hub and the hospital. In terms of the living well piece, what are the kinds of things I should be doing if I have diabetes?
So I suppose number one is people with type 2, for example, a lot of the time they come to us and there are immediate lifestyle changes that have a huge impact without ever prescribing a tablet. People have done really well with lifestyle changes. And education, not realising that a can of Coke has so many calories and not to take that full sugar can of Coke. Like little changes, little steps, tailor-made to the patient that's sitting in front of you. Meeting your patient where they are. What are they coming to you with? It's not just diabetes. There could be a load of stresses in their life. So you have to just really sit and listen and spend time and get a good working, effective plan with them. Type 1 patients must take their insulin to survive. There is no way around that. So they have to take their insulin, have to be compliant with that and inject and be educated and supported with all of that. Dietary education, so good sit down with dietitian. The dietitians will be talking later on about their services and what they offer. Taking their tablets, understanding their medications and understanding what they do. We just don't like to prescribe tablets for patients and just say, take them. Patients like to be informed, and in fact, patients are even more and more informed nowadays. And you have to respect that. And I think helping patients understand what they're taking tablets for, the whole attitude of taking tablets, they understand and they will take them, and they'll understand the importance of that.
And you mentioned the dietitian there earlier on as one of the team members who I might see in relation to my diabetes. In terms of those services available across Tallaght University Hospital and the Chronic Disease Management Hub, who else can I expect to support me and help me with a lot of that understanding?
So it's great that the Integrated Care Hub is working in partnership with Tallaght University Hospital, and what we have noticed in the last year now, we're up and running a little over a year, is that we are able to remove patients from a very long waiting list. We all know about waiting lists in the health service, very long waiting list, and have them seen in the Chronic Disease Hub. And if our patients have one or two visits to the hub, it is episodic visits that we're talking about, we can get them right on track, get them with a treatment plan, back to their GP for care. However, if they are deemed more complex, we will have them seen in Tallaght University Hospital. So it's a lovely, fluid kind of way of treating your patient with diabetes. And we don't want patients waiting around with problems and with chronic disease health problems, because that does not end well. It does not bode well, and we don't want patients becoming unwell and ending up in an already clogged and very busy emergency department.
Sure. And it sounds like from what you're saying today that people can live well and age well with their diabetes in the long term. So in that context, what are the available resources for patients living with diabetes, both here at TALA, in the community, and maybe, in Ireland in general?
So there are lots of resources out there, and it's our job to signpost the best fitting resources to our patients once we know our patients, their needs, their literacy skills, their language. So the Health Service Executive, the HSC, have a wonderful website, and they've got services available online or downloadable and printable. They've got 12 different languages. So we know our Ireland today is multi-diverse, multicultural, and we want all our patients to receive equal care and get the right information. So Diabetes Ireland as well is the main advocacy group for people with diabetes in Ireland, and they have a wonderful website. They have lovely recipes for people with diabetes or without diabetes. They have talks nationwide that happen from time to time around the country, and they're lovely. When patients go to those talks, they meet other patients and they get to talk to each other and support each other. And they have numerous education groups, and patients can actually sign up themselves, can sign up for an education program, newly diagnosed patients with diabetes, or in fact even patients who've had diabetes for many years and want a little refresher. That's there for them. And we know with COVID, a lot of things kind of were left on the back burner, and maybe people kind of focused more on other things rather than the immediate health needs that they might have. They focused on other, health needs of family members. So a platform like Diabetes Ireland is definitely something that I would direct patients to, and even for GPs who have no immediate resource for their patients, something like Do the Smart Diabetes course, which is available on the diabetes website, would be a wonderful starting point.
So Diabetes Ireland provide resources for both professionals and for individuals living with diabetes, and obviously families and carers. So it sounds like living with diabetes and having diabetes in Ireland is well supported, well resourced, and certainly listening to the work that you do in your hub and in the hospital. If I was to be a patient living with diabetes, I would find that one-stop shop, which is lovely to hear. For our listeners to this particular podcast, before we wrap up, I'm just wondering if you were to give them a take-home message, if you were to give them that nugget that you'd like them to keep with them in terms of diabetes and living with diabetes, what would that be?
So I suppose attend your appointments as much as possible as you can. I know a lot of patients, especially are type 2s, older, they have other health conditions and they have multiple health hospital appointments. But we are trying now to shift care closer to home, the right care to the right patient at the right time. And all our patients with medical cards can avail of 2 visits a year in their local GPs. So that maybe makes attending their diabetes appointment a little bit easier. And advocate for themselves, know their numbers, so the health professional will sit down with them on diagnosis, and at each clinic visit remind them what their blood sugars should be, what their cholesterol should be. They should have their feet checked once a year. Protect themselves and raise the alarm and contact a health professional if they feel that something is not right. If they have a little sore on their toe that just is not getting better, they need to know where to go and be informed of who to contact to take care of that so that it doesn't get any worse.
Great. Thank you so much. So I'd like to thank Anne for coming in to talk to us all about diabetes. It's been really interesting listening to you. And thank you all for listening. In our next podcast, we will be joined by Michelle, a patient living with diabetes, and Anne will be back again discussing what it's like to have that real lived experience of diabetes. This Let's Talk About Diabetes series has been brought to you by TALA University Hospital in partnership with the Healthy Communities Development section of South Dublin County Partnership.